We heard data here at the ACR meeting for the first time about a JAK inhibitor, tofacitinib, and its benefits and safety in psoriatic arthritis. There were two key phase 3 studies that were reported. One is OPAL Broaden, in which patients who had been previously treated with DMARD medications, but not TNF medications, were given tofacitinib either 5 or 10 milligrams twice a day. There was a comparator group with adalimumab and placebo. And all of the key clinical domains of psoriatic arthritis were measured. And what was exciting was that there was benefit in all of the key clinical domains. So the primary endpoint, ACR20 response, at 3 months was seen in 50% of the 5 milligram group, 61% of the 10 milligram group. And the other key measures, function as measured by the HAC, quality of life, enthesitis, which is inflammation where tendons or ligaments insert into bone, dactylitis, skin responses, and X-ray outcomes all showed improvement. Another important point from the study was that although the primary endpoint was at 3 months, in the NRI analysis we saw that even there was climbing response, with greater degrees of responsiveness out at 12 months. So this study really shows us that tofacitinib is very effective in treating psoriatic arthritis. And the safety was the same, with nothing new, as has been seen in rheumatoid arthritis. Some infections, there was some zoster, and we also saw lab abnormalities such as LFT or lipid abnormalities, but they were not any different than what we've seen in rheumatoid arthritis. The other key study that was presented at ACR was in a population of patients who had been treated with TNF inhibitors and had inadequate response, or for other reasons had stopped their TNF medication and were treated in the same way with tofacitinib 5 milligrams or 10 milligrams twice a day. And what was really striking in that study was that the responses, especially as we saw in the 5 milligram group, were very similar to the TNF naive study. And so in all of the key clinical domains, ACR20 response and other ACR responses, function, enthesitis, dactylitis, etc., and the skin, we saw important improvements. And again, the safety profile was very similar to what we've seen in the treatment of rheumatoid arthritis.